Welcome! In this presentation, you will learn about different kinds of insurances and what they cover. You will get a brief understanding of medical coding and how medical insurance claims are processed. Here are some types of government insurances. CHAMPA, Veterans Affairs. The VA will share the cost of certain services and supplies. COBRA will allow an ex-employee to continue to receive health care coverage after being terminated. Medicare is a federal health insurance program for anyone 65 years or older, under the age with certain disabilities, or anyone at any age with end-stage renal disease. Medicaid, a program for low-income families, elderly, or children to receive health care. CHIP, Children's Health Insurance Program, health insurance to families with children. TRICARE, insurance program for active military personnel and their families. Workman's Comp. This program will help employees who may become hurt while performing at work. Other types of insurances. Blue Cross Blue Shield. PPO, Preferred Provider Organization. This is where a patient can choose from a list of providers that are in network. HMO, Health Maintenance Organization, a group of providers, medical facilities, healthcare services that are in network. Point of service, hybrid of HMO and PPO. The patient has the option to select a provider out of network, need a referral for services. The four parts of Medicare. Medicare is a federal health insurance program for people who are 65 years or older, under the age with certain disabilities, or any age who have end-stage renal disease. The program is funded by a person's payroll, taxes, or people who have Medicare. Medicare has four parts known as Medicare A, Medicare B, Medicare C, and Medicare D. Medicare A helps pay for inpatient hospital care, inpatient SNF after a hospital stay, some home and health care, and hospice care. Medical B, medical insurance, helps pay for physician services, home health for patients without Part A, ambulance, laboratory and diagnostic services, surgical supplies, medical equipment, prosthetics and supplies, hospital outpatient services, and outpatient physical therapy, OT and speech therapy. The patient is responsible for payment of a deductible or co-insurance with Medicare B. Medicare Supplement Health Insurance will help pay for some of those costs. Medical Supplement Health Insurance, Medigap, is private insurance companies that will help pay for some of the costs that original Medicare doesn't cover. To receive Medigap, you must have Part A and B to get coverage. Medicare C is also known as Medicare Advantage, MA. MA contracts with Centers for Medicare Services to provide coverage of health services. MA provides Medicare Part A and Medicare Part B with extra benefits. The extra benefits may include hearing, dental, prescription drug coverage, health and wellness. Medicare Part D is known as the Prescription Drug Plan. It is a non-governmental plan that helps patients get coverage for certain FDA-approved prescription drugs. This plan is for people who are on Medicare but don't already have prescription coverage. Here are some other types of insurances. General liability insurance. This insurance helps protect small businesses that is, in case if something happens, they are covered if a person decides to sue the company. Workman's compensation insurance. It is a state law to have all employees be covered under a workman's comp in case an employee becomes injured at or performing work. Claim cycle. An insurance claim is an application form to the insurance company in order for the provider to get paid for the services provided by the provider to the insured patients. Claim cycle. The first step is to register. At this time, a provider will gather updated personal information and updated insurance information from the patient. Insurance verification. The provider will verify the patient's insurance and what costs they will be responsible for. It is important that the patient understands what their coverage is and what they are responsible for. Record service. The provider will examine the patient and determine a diagnosis for that patient. The provider will document detailed information about that exam in the patient's medical records. Medical coding. A medical coder will take the medical records with the patient's diagnosis and assign the diagnosis an ICD-10 code. This code will help pay the provider correctly for their services. Submit claim. The biller will fill out the insurance claim form and submit the claim to the insurance company to process. Collect patient's payment. Depending on the patient's insurance policy, a patient would be responsible for their copay, deductible, and out-of-pocket expenses. The provider will collect payment from the patient and document that the patient has paid in patient's medical file. Receive and post payments. The insurance will process claim and then submit payment to the provider. The provider will apply payment to the patient's account and make the claim closed. Type of claims forms. A provider will fill out a claim form to send to the insurance companies. There's pretty much two main claim forms. The CMS 1500 form is used mostly by small offices or non-institutional providers. The UB04 form is used for mostly hospital stays that provide procedures. This form has the ability to record multiple codes to claim for procedures and supplies used. Claim denied and rejected. As the Medicare Administrative Contractor, MAC, reviews the claim that was submitted by the provider, they look for a couple of things. They will look to see if the claim is fraud, waste, abuse, or error. Such actions may have the claim denied. This is why it is very important to make sure the provider has documented correctly and that the documentation matches the claim that was submitted in case there was to be an audit. A denied or rejected claim will be no payment for the insurance, from the insurance. Denied claim could have been missing important information, or the insurance denied the patient's coverage. A provider can appeal a claim if they feel they can provide documentation to prove the claim. A rejection claim may be due to errors such as wrong address or incorrect insurance for patient. The provider can correct the error and resubmit the claim for it to be processed again. Election of benefits, EOB. Adjustment contract is a loss that the provider must take if the provider charged more than the total amount allowed. This is because the provider has a contract with the insurance company. They can also not charge the patient the loss, they just simply take the loss. Depending on the insurance policy, a patient's responsibility for payment would be a co-payment, co-insurance, and a deductible. Collections. A bill is sent out asking the patient to pay the full balance that they are responsible for. If a patient does not pay the bill in 30 days, a letter will be sent out to remind them of the bill. At 45 to 60 days after the bill was sent out, a phone call is placed from the provider to remind them of the bill. After 120 days, the bill may be sent out to collections. If the patient pays the claim bill and the provider has received payment for the claim, this is now the claim is considered to be closed. Thank you for your time. I hope you have gained some knowledge about insurance and submitting a claim. If you have any questions, please feel free to come and ask the office manager or any of the supervisors. We know and understand that insurance, billing, and coding can be difficult at times. We hope this presentation helps. Thank you.